The vast majority of scales and screeners that I use take less than 5 to 10 minutes to administer and score. Now, I have to be honest, most of them actually lean closer towards the 5 minutes than they do the 10 minutes. So in my practice setting, as a psychotherapist, I have a full hour with people, sometimes 90 minutes if it's initial evaluation. So 5 to 10 minutes, even if I extended that by doing multiple scales and screeners to 20 minutes, that's reasonable for me. However, I have a lot of colleagues who practice in settings where 5 to 10 minutes is the full amount of time they get with their patient. So when I'm saying 5 or 10 minutes seems reasonable, they're looking at me like, really? That's not enough time for me to do everything I need to do. So here's the challenge. Again, it goes back to what we said earlier about the pushback being, I simply don't have enough time. Well, I worked with a group of primary care doctors maybe 10, 12 years ago that I was called in to meet with them to talk about scales and screeners. And I found a gold mine because this group of clinicians had been using scales and screeners for 10 plus years. It was a routine part of their procedure and they loved them. So my question, I thought this is a great chance for me to learn. I told them, clinicians, the pushback is this: I don't have enough time. They laughed, huge belly laughs. They thought it was hysterical. And I thought, well, this is kind of odd. Why are you laughing? Teach me what I need to know. If you were presenting and you heard that, what would you say? And this is what the lead physician in that group said. He said, when we first started using scales and screeners, we thought the same thing. Good Lord, we don't have enough time. We've only got 5 or 10 minutes. Don't ask us to do something else. And what they learned very quickly once they began initiating the routine use is it didn't actually cost them more time. And this is their words. It actually saved them time. And for me, that's the best learning experience. That's the most valuable thing I can tell you. That for those clinicians, what they said is when we put that extra little bit of effort and time on the front end, it saves us a world of time on the back end if we were in fact missing a diagnosis or making an incorrect diagnosis. So again, it saves us time. We just have to change that mindset and begin to routinely incorporate them into our practice settings. The majority of scales and screeners that are discussed on Psych Congress Network have about 80% or higher sensitivity and specificity. And that really is the benchmark for any tools that you might be considering using. It's not so much about what diagnostic evidence the scales and screeners might capture that we as clinicians wouldn't obtain through just general clinical observations. The question is really about making sure that we as clinicians do our very best not to miss anything. So remember what I said in an earlier question. Scales and screeners, they're like safety nets. They're our insurance, if you will, to help us not miss that valuable, important clinical information. With the number of scales and screeners that are available, I definitely understand how the prospect of selecting them is a bit overwhelming for those of us who might be new to using these tools. So this is what I always suggest. Pick 2 or 3 as a starting place. And again, you might want to cover disorders such as major depression, bipolar disorder, and something for anxiety disorders. So let's bundle together a PHQ-9 for major depression, an MDQ, mood disorder questionnaire for bipolar disorder, and GAD-7 for anxiety. And that'll be your starting point. And keep in mind, you can certainly add to that or take away. If you're already using something perhaps, or someone in your office is using something, add that to your list. Again, it's just about getting comfortable and using them. And what you'll see and what you'll find very quickly is they're very easy to use, very efficient, and take very little time. So I'd like to thank everybody today for joining us for the video discussion, looking at the value and importance of using psychiatric scales and screeners in our clinical practices. I hope you found today's conversation useful, and I'll look forward to talking to you later on about the same topic.